Hey guys. All right, tonight I'm going to touch on autoimmune disease and triggers because there are a few people in the group who have got autoimmune conditions. The most common one that's popping up is rheumatoid arthritis. But first of all, what is an autoimmune condition or autoimmune disease? It is when your body's own immune system starts to attack itself. And depending on what condition you have, you'll have different tissues affected and different symptoms. So there's genetics and epigenetics that I'm going to go into and explain. Don't worry, it sounds complex, but it isn't. So a lot of people can have a genetic predisposition. So there may be family members, parents, grandparents who may have had a known autoimmune condition. So it doesn't mean that you're destined to develop this condition just because you have your genes. And there's a really great guy called Bruce Lipton, who is an American, I think he's a cell biologist or a professor, and he actually lives in Kerikeri up in the North Island of New Zealand 6 months of the year, and he teaches the chiropractors up there, which is pretty amazing. But he has a great book called The Biology of Belief, and he's done a lot of study around cells and genes and showing that the environment we put them in can dictate whether or not they activate or not. So just because you think that you've got the gene or your parents have had an autoimmune condition or even cancers they talk about as well, doesn't necessarily mean that you have to turn that gene on. And this is where I talk about providing an ideal environment for yourself and for your cells so that they're not under stress and they don't turn on and start to cause you symptoms. So you may have the gene, but it doesn't have to activate. Different types of autoimmune diseases, the ones that we commonly see in clinic are related to the joints. So rheumatoid arthritis, ankylosing spondylitis, polymyalgia rheumatica is another one. And then you can get ones that affect the skin and mucous membrane. So there's one called Sjögren's syndrome, which is really interesting. People, they get a really dry mouth. They can't cry even if they want to. Everything just dries up. Psoriasis is another one where you get those white scaly plaques on your skin. And lupus is also a skin condition, but it can also affect your joints as well. So all these connective tissues get quite inflamed. And depending on what degree you have, joints or organs can get destroyed quite quickly. Celiac disease is another one, affects the gut. A lot of people know this as the gluten intolerance or an allergy to gluten. And then thyroid as well. So Graves' disease, where you get a hyperactive thyroid. The thyroid governs your metabolic hormones. So it can become quite hyperactive. And then Hashimoto's, which is where you have low thyroid as well. So that's just a few autoimmune conditions. For those of you who have got those, you'll be able to relate to this. So what triggers them is different types of stress. And I find myself talking a lot about the 3 different types of stress. There's physical, so pretty much like burning the candle at both ends, or it can be seen as overtraining your body physically. We live in a town where there's a lot of endurance athletes and climbers, and they push the limits pretty hard. And unfortunately, it doesn't go too well. Physical stress. So then there's emotional stress as well. This can be a lot around even workplaces. So workplace bullying, being unhappy in your workplace, divorce, relationship issues, grief, so losing someone close to you and not dealing with it as well as you might have been able to. Those are emotional triggers. And then physiological is when we get things like illnesses, so sickness, viruses. I do know a few people who have mentioned to me as patients they don't have proof and no one's said that this is the case. However, after within 24, 48 hours of having a vaccination or a shot, they have had all these symptoms triggered. I'm not pro or anti-vaccine, but just sharing what I have learnt from my patients over the years. So before I get into the emotional stuff, there are some signs and symptoms that you want to look out for. I've had quite a few patients over the years that come in thinking they've got musculoskeletal problems, but there's a few little flags that let me think, okay, something else is going on. So usually the autoimmune conditions are quite inflammatory to the body. So they will normally actually get worse after a treatment. So feel really sore because you're feeling all that inflammation. So they don't respond like you expect. The other thing is that they tend to have bilateral or both-sided discomfort. So it could be all their fingers, their wrists, their elbow, shoulders, hips, and knees or ankles. And typically they're really stiff in the morning. They feel okay during the day, but the stiffness in the morning is quite significant. And they'll usually have other stuff that's going on, like certain types of stress that we try and make that link, or they're really tired. And getting random fevers as well is another sign. So usually you can go to your GP and you can ask for some blood tests, and they should look at inflammatory markers. And yeah, if you really know that something's not right in your body, is that you push and you ask questions, and maybe you need to get a second opinion as well, because we have had some patients have this missed, unfortunately, and it's really hard when you're in pain and discomfort to advocate for yourself. So those are some signs and symptoms. Those are more the joint related ones. And then from speaking to quite a few patients, changes to look at is you can get them to different severities. So you can have autoimmune conditions that are highly inflamed and really wipe you out. You have to stop work, all sorts of things. And a lot of it does come down to looking at what is the situation that triggered it. So if it is a physical or emotional stress, a lot of my patients, I say, what do you think triggered it? And they'll be able to put it down to a life situation, workplace environment, or something like that. So looking at changing your lifestyle, and sometimes that does require some really big decisions, and it is important that you get some help to try and actually get yourself out of pain so that you can make clearer decisions. And then diet is a huge one. And I know that I've found myself over the years thinking I've got quite a healthy diet, but always open to learn new things. Now, one diet doesn't fit everyone. We know that there's lots of amazing diets out there, and it's important that you give it a go, it resonates with you, and it works for you. Don't keep pushing if it doesn't work for you. So you might need to take little bits from a vegan diet, little bits from a keto diet, and little bits from an autoimmune paleo diet. I've seen people really resolve their symptoms with massive dietary changes, and actually found that a lot of other issues that they've had have resolved as well. Yeah, so diet is probably the big one, and then massive lifestyle changes, removing yourself from an environment. So it could be a climate, but it could be a stressful environment, or even the people who are just really toxic in your life. But I'm going to go into, so I use this book that I've shown you guys before, The Secret Language of Your Body by Ina Segal. And I've personally noticed with, I'm going to go into rheumatoid arthritis because that's what a few people have brought up. I've usually noticed the traits in people with rheumatoid arthritis is that they can have some underlying anxiety, and probably the biggest thing is a sense of control, probably like, what do you call them? Control freak. I can't put it nicely, sorry. So I'm going to read this, rheumatoid arthritis. Now, when I read these, they do sound quite negative, but you may or may not resonate with it, particularly if you've got rheumatoid arthritis, let me know. So self-rejection, criticism, stuckness, negativity, stubbornness, a my way or the highway attitude, serious, rigid, controlling, a perfectionist, nothing ever seems to be good enough, inner inflexibility, which keeps you and your joints stuck, inflamed, and in pain, holding on to pain, sadness, regret, or guilt from the past, and refusal to change. So yeah, the big thing with that is the change there can be a lot of resistance to that, but normally whenever you've got these physical ailments, and especially autoimmune conditions, is that they do require you to take some change. So what I would encourage you to do is, if you've got an autoimmune condition, is start reaching out, asking for help, and just be open to what you can actually do. There's some pretty heavy medications out there, and the ones that I've seen who have turned a corner and maybe put their rheumatoid arthritis or autoimmune conditions into remission, They are the ones that have had made big changes. They know what stresses them, they know what to avoid, and they know what food really helps their body. So I hope that's helped you. I've got a comment here, but I can't look at it. So oh, here we go. Oh, Andrea, who I used to work with in Melbourne, is a building biologist, and she's also said very often it comes from mold exposure too. So mold exposure, I would look at a physiological, environmental stress to the body. And that's only something that a lot of integrative doctors or decent naturopaths will look into. So let me know if you've got any questions on that, or if you want me to go into any other conditions. Sjogren's syndrome is another one that I'm going to go into. But yeah, any other specific autoimmune conditions, I would love to give you some insight. Have a great night. Bye.